Hi everybody, and welcome to Physiotherapy Presents Health, Wellness, and Lifestyle. My name is Madelaine Golec, and I'm a pelvic health physiotherapist and the owner of Physiotherapy. And today I am doing a solo show. So calling all ladies. If you're thinking about getting pregnant or are pregnant, this show is definitely for you. So as a pelvic health physiotherapist, most of the ladies that I'm treating are actually coming to see me after they've already had a baby. And what I began to realize over, the last year or two is that women would come and would tell me during their appointments, I really wish somebody had told me this beforehand, or I wish I had known sooner, or if I had known what to do, then I could have done something sooner. And I began to realize that there's a problem here, because it wasn't just one woman saying, I wish I had more information during my pregnancy, or I wish I knew what to expect after having a baby. It was frequently more than one woman saying the same thing. So I'm like, okay, there's a problem here. So I basically was trying to think, okay, so how can I provide a solution to this problem? So over the past couple months, I've been working on what's called the pregnancy guide. So I'm creating basically a guide of what to expect during pregnancy and postpartum. So like what's normal after having a baby and what's not normal after having a baby. Because one of the things I've also found is that, social media or even some healthcare providers, when a woman's presenting a problem she's having, they're being told, well, that's just a normal part of having a baby. And in some cases, the answer is it's not normal. It might be common, but it's not normal. So I thought if I put together this guide, it would help women access information about what to expect, and not only that, but what they can do about it. Because for me, it's about educating and empowering the woman to be able to make decisions for herself, and be able to take her health into her own hands. Because of course, we all want healthy babies, and we all want the birthing process to be safe for the baby, but there is also us too, and we need to be safe, and we need to be healthy as well. So in 2018, we will be launching the pregnancy guide that will be available on our website, www.ecophysio.com, and it'll be accessible for free for anybody who might be interested in that. So definitely keep an eye out. If you aren't part of our social media, make sure you following us on Instagram or Facebook, Twitter, as we'll announce as soon as that becomes available online. So one of the other ways that I thought, okay, what else can I do to provide a solution to this problem of I wish I knew? And so what I've done and what I'm offering is what I call sort of the labor and delivery appointment. So at about 36, 37 weeks of pregnancy, women will come in and do a session with me. And in that session, we go over a lot of different education. So things that women were commonly saying, I wish I had known about. So we talk about, tearing. We talk about, healing postpartum. We talk about the ab separation and how to protect against the ab separation staying open after delivery. So we go over some posture, we go over some standing and sitting principles, how to get in and out of bed, with keeping in mind how to keep the body safe and make sure that the pelvic floor isn't being put through any additional distress once you've had the baby. We talk about different things like that can help with aiding and improving and optimizing your labor and delivery, and any other issue that you might be having, whether it's pain or incontinence. So we talk about those things and what to expect. We also go over different exercises. So if you are experiencing pain, specifically like in the front of the pubic bone or in the back of the pubic bone, if putting on your socks and standing on one foot is painful, there's some very specific exercises that we can go through to help align the pelvis and reduce some of the tension that's being placed on some more sensitive structures when in a weight shifting activity. So for example, shifting your weight onto one foot to put your sock on, that's considered a weight shift activity. And so there's some exercises we can do around that to help be supportive in light of some, pregnancy hormones. And of course, your body is also not used to the extra weight, whether it's from the extra blood volume that we're carrying, also the weight of the baby. So our muscles are being sort of put to the test, which they might not necessarily have been used to being worked out in that way. And within that appointment, we go through a pelvic floor assessment. So what I want to determine is how well you're connected with your pelvic floor, because most women, we don't think about sort of down there until there's sort of a problem, and then there could be some issues about connecting to those muscles. So if we can do that before those muscles get put to the test in labor and delivery, it kind of gives you a head start. You're already connected to those muscles. You already know what it feels like to contract them. So not only do I teach you sort of Kegels, if that is something that I need to teach you, but we also go over how to relax the pelvic floor, because for labor, we need to open up. We need to create space for that baby to pass through the birth canal and obviously enter into the world. So if we can learn how to relax in that area and be practicing that, such that when those intense contractions are happening, you've been practicing learning how to relax into a variety of different sensations. So it kind of helps to reduce fear, and by reducing fear, we reduce tension. And if we can sort of reduce tension, we hope that it also helps to reduce any possible trauma of giving birth. So in that assessment, we'll go over sort of perineal massage and perineal stretch. So I kind of introduced to you some of the sensations that you might be experiencing and teach you how to relax into those sensations. So we go over some different breathing techniques, relaxation techniques that you can then utilize for that labor and delivery. And then, of course, we talk about postpartum care. So how to deal with swelling, how to deal with positioning ourselves to train the pelvic floor in the most ideal position in early postpartum. So by having the appointment at 36, 37 weeks, if you are practicing Kegels, then that gives you a head start. Once you've had the baby, you can start exercising those muscles right away, which basically gives you sort of a 6-week head start, because as a therapist, I usually I don't assess until 6 weeks has passed, because everything has to heal before we can perform an examination again. So by having the appointment in advance, that gives you the opportunity to practice within that 6-week time period, which allows you to start regaining control over your bladder or gas or bowels. So that's kind of the benefits of doing that before the actual labor and delivery. So there's a lot of things that we go through. I jam, a lot of great value within an hour appointment, and usually I don't necessarily need any follow-ups leading up to the labor delivery unless there's something in particular we need to follow up with. So usually they'll see me beforehand, and then they'll see me at the 6-week postpartum follow-up to basically reassess and see how everything's going. So one of the things I did want to talk about today is called the epi-no, and this is the epi-no. So this is a special device that can be used for preparing for labor and delivery. So you can do perineal massage and perineal stretch. You can start that at 34 weeks, but the epi-no you have to wait till you're 37 weeks. It is considered full term at 37 weeks, and I mean, when I was 37 weeks, I was sort of hoping that this would, put me into labor. It doesn't. But just to be on the always on the safer side, it's recommended that you start using this device at 37 weeks. So basically, what you do, so this is a balloon. You would insert the balloon. You can see, well, it might be difficult to see, but there's kind of a divot here in the balloon. And so you would insert the balloon about halfway to that divot inside the vagina, and then basically you would start to pump up the balloon. So this device, it can be used to replace the perineal stretch and perineal massage, and essentially it begins to start stretching the tissue. So as the balloon is pumping, you're practicing your breathing and relaxation techniques that we've sort of gone through in the assessment, in the appointment. And every day for 5 to 10 minutes, you are pumping it up, practicing your breathing, trying to pump it more. And then finally, when the 5-10 minutes is up, you're practicing that relaxation, your breathing technique to allow the balloon to come out inflated. So it's kind of mimicking what sort of birthing might feel like. And the reason we want to have the balloon come out inflated is that we can use the measurement template that basically shows us how many centimeters we're able to inflate the balloon. So the template does go to 10 centimeters. So that's why it needs to come out inflated. And so every day you're practicing and practicing. This is a really handy device because for some ladies it might be difficult to reach to do the perineal massage and perineal stretch. Someone will sometimes ask their spouses to do that. This allows you to do it for yourself. And what I like about it is that it allows you to feel some of the sensations that you might experience during the labor and delivery what's the word I'm trying to think of, during the labor and delivery experience. So as a first-time mom or a mom who had a C-section first but is preparing for a VBAC, it can be kind of scary. You don't know what it's going to feel like, and you don't know what sensations you're going to feel. So that's why I like using this device, is because it kind of begins to expose you to some of those sensations and allows you to practice remaining relaxed during those sensations. As with anything in life, we can't guarantee that the device will reduce the likelihood of tearing, but we do know that if you can reduce tension and keep the area relaxed, that can help with reducing some of the trauma of the birthing process. So like I said, this device you can start to use at 37 weeks, and we do carry that in clinic. It is also available for purchase online through our website. So I think the biggest thing for me and what's really important is I want women to know that we're built to make babies, and we're built to have babies. We've been doing it since the time humans have been, on this planet. We as women have been giving birth, and I just want women out there to know that, you're a warrior princess. I don't know why warrior princess is in my mind, probably because I'm watching Vikings and I'm thinking, strong and beautiful, and is just such a intensely passionate moment when we're welcoming our child into this world. And I had the benefit of being able to have somebody teach me how strong I really am and how capable I am to give birth. And I really want to be able to share that with you. So I want to give you a couple of resources and a couple of people who I think are warriors themselves and are very much working to help empower women during this beautiful time in their lives. So I first have to give a shout out to Chris Petter of Beautiful Bellies Doula Care. So I did hypnobirthing with Chris, and she was the first person to teach me about how my body was capable of birthing this baby, and that birthing doesn't have to be scary, and it doesn't have to be traumatic, and it can be beautiful and a rite of passage. And I'm so grateful to her for that. So I have to give her a shout out. So that's Beautiful Bellies Doula Care, and it's Chris Petter that runs the hypnobirthing. Of course, there's Sarah Mason of My Confident Birth. She's a certified doula and postpartum doula. Her and I have been putting together videos which are available on our YouTube channel, Eco Physiotherapy. So we put out a video on how to select your medical provider. So if you're thinking, do I want a midwife? Do I want an OB? Do I want a doula? You definitely want to check out that video. We also just recently ran a show on how to optimize labor. So for those ladies that are getting really, really close to having the baby, please, go to our go to our YouTube channel and check out that video with Sarah Mason. Of course, there's a shout out to Grace Jose of Graceful Birth out in Oakville. There's Carol and Sarah from Lifetime of Love Doula Services, more Brampton, Orangeville, Mississauga area. All these women are out there really trying to educate and really trying to help women have the best birth that they possibly can have. So if you're thinking about a doula or for some postpartum care, please, check out their websites. Lots of great information there. I have to give a shout out to Jennifer Stelmatch from Sweet Pea Breastfeeding. So for all those ladies that may or are having some breastfeeding issues, check out her website. She is amazing, and she is very much about helping women through the breastfeeding process. A couple of sleep consultants that I want to give a shout out to. So Kim Sotman from Rest Easy Sleep Consulting out in Toronto. There's Brooke from Bedtime Beginnings out in London. I know Carol and Sarah from Lifetime of Love also offer sleep consulting. Of course, I have to give a shout out to Dr. Emily Lipinski, our naturopathic doctor. She is amazing with helping women make sure that they have their nutrition and diet on board, and that you're taking the right supplements. So if you're thinking you need some help with that, definitely think about contacting her with respect to that. So I think that's what I wanted to mainly get out. And I just sort of have, a call to action. If you're that warrior princess embarking on your pregnancy journey, seek out the education and resources now. Empower yourself to have the knowledge to make, decisions for yourself. And even if your birth doesn't go the way that you had hoped it to go, at least you'll have the information about, kind of what's happening to your body, why certain things might be happening during your birthing process, that at least you feel empowered through knowledge. And, check out these different people, build your warrior team. And then my other call to action is to any doulas or midwives or anybody that's involved in the birthing or babies industry. I would love to connect with you and see if there's a way for us to collaborate to educate and empower women to look at themselves as the princesses that they are, and it's just about empowering women to be confident in their abilities during this rite of passage. Anyways, thanks so much for following along, and I appreciate it. Bye for now.